there's been a big push in private equity and across multiple fields, including urology. And the issue is, what's the value in that? And what are we attempting to do within our Southern California market with our private equity partner as we head towards value-based care? I mean, is there really a role in that? So, we've been down this road before, and we're going to keep going down it. And one of these days, we're going to get it right. We've got to change how we take care of people in this country. Everyone knows we're spending close to 18% of our GDP on healthcare. It's a tremendous amount of money. And we spend more than anybody else, and we provide the more sophisticated countries some of the worst health care for those dollars. So the question is, what can we do to do better? And this has been something we've been battling for some time. So if you believe this is the continuum, that we start off with this episodic single, or multi-site bundling, trying to figure out how to lower the cost of healthcare. We're heading towards a direction where we're going to get back to something that I did when I first started in practice some 30 years ago, which is capitation. But the concept of, and it's a note I have later in my slide, that it's not about how many widgets we produce, it's about how many widgets we can take care of. So healthcare is going through a process where we have to change how we take care of patients. And we're heading towards, with a big push now, through the our shared savings ACO, heading towards risk ACO and risk contracting, essentially all the way out to capitation, which will, I think the real future is going to be how well you can manage a patient population, take risk for that population, and that's where the economics, as I put on again my enterprise hat, will be to maintain independent private practice. Independent practice has been increasingly difficult to remain viable as an independent physician. There's been increased costs of doing business, expenses keep going up. Right now, we're in a place that I have never been before. I mean, the Great Resignation is amazingly scary, and the price inflation taking place is impressive, but we're not able to really raise our prices. We need to figure out how to generate other income streams to remain viable as independent physicians. We need to be competitive with the employed physician market in our area. We need to really have a seat at the table as we move towards a value-based care. And independent onesie-twosies or three-man groups are not going to be able to do this. We truly believe that value-based care is in our future. And the question is, how does the independent practitioner engage in this new arena going forward? Is it only going to be solely at the discretion of large multi-specialty groups that are going to be able to take this risk contracting on? Is the independent physician only going to be able to access this via an ACO model if they're allowed into an ACO model, which are becoming now more restrictive in every community as the rules are changing? Or are you going to access it via a IPA model, which doesn't give you much control? You're kind of given what you're given. And so, how is it that we're going to stay involved in this? And I think the answer is we've got to get, as independent physicians, we've got to group up. We've got to have some leverage across a larger community and be able to take care of a larger community of, in my case, urology patients throughout, for instance, Southern California. And of course, to do that, you need, it's all about data now. You need better data management and reporting. You look for increased revenue streams, and the grouping up allows you to get some scale in the delivery of that, and that helps. My feeling is, if our goal has always been to be independent physicians in an independent market, you join a hospital, which is essentially, or get gobbled up by one, you really lose some of that autonomy. I really think the survival is going to be for independent physicians becoming and staying independent is about grouping up. Easy in the past, a couple guys would join another couple guys, and everyone would say, okay, let's just keep doing our thing. It's gotten much more difficult now to bring groups together. It really does require capital. Capital's harder and harder to come by. Physicians, the market is a lot more difficult. This is where private equity comes in to give us a hand. They also provide truly experienced management. In our case, I ran a very good doctor business, 28 doctors for about 10 years. And we're expanding. We're up to about 64 providers at this case. And it's running more like a business as a business should, and I think that's actually going to help us, again, be competitive in the market. So private equity provides the capital, improves the management, allows some expansion of our ancillary revenue streams, and allows for us to consolidate and continue to remain independent. And it really does provide in all these communities the counterbalance to the organized medicine approach, which has in some communities shown to be detrimental to the community when one player monopolizes that community in the delivery of health care. So the maintenance of independent private practice is paramount, which is kind of interesting, back to my first talk, is why, and this is what we're trying to get the legislators to understand, is controlling independent private practice doesn't create prevent an anti-competitive environment. It supports a competitive environment, which is essentially what they're trying to accomplish. So we've got a lot of education to do. But it's imperative that you do this with a partner that's aligned with that concept. And I happen to find the right partner to align for the concept that we're doing, very much involved with bringing in the small practices, creating an environment that will allow us to grow and expand. It's imperative to have the right partner with the right vision. I think if we get big enough in size, we'll be actually able to do risk contracting as a single specialty. I do not know that ancillary revenue streams are going to continue to supply the revenue that we're going to need into the future. I think the risk contracting, risk sharing is what's going to do it. And I believe that again, the survival of independent private practice will be more about how we manage widgets than how many widgets we actually make. And again, as I stated earlier, that as hospitals consolidate and create market control, there needs to be the counterbalance, and I see independent private practice as that counterbalance.